So I will start, and I will also correlate to our session from yesterday. And I will do spoiler. In Hebrew, you say spoiler. In English, it's also spoiler. So this is the MSDQ questionnaire. And I will speak about the MSDQ, Medical Somatic Dissociation Questionnaire, that was published in Child Sexual Abuse in the journals of Bob editors. And what we spoke yesterday, it's about sexual abuse during childhood cause short and long-term physical, emotion, and psychological effect. Oh, you see, I mean, yes, okay. And also that a small number of children are diagnosed, or we had we had the debate between assessment and diagnosed. But because I'm coming from the medical arena, they're speaking about diagnosis, and I think when we're speaking about assessment as a culture of expertise, we should think about medical, social, and diagnosis, and not just assessment, because I think it's most like it's integrated together. And what we spoke yesterday about, I found the reference, the total lifetime economic burden resulting from child maltreatment in the United States in 2008 was approximately 124 billion. And this is answer for the question that I asked you, all of us, yesterday. So why are we spend this money on women and men in the oxygen hyperbaric, or in treatment in Isabel's treatment centers, and when we can prevent them and try to prevent and find them? And what is these billions are going just in the United States? Think about globally how much we're spending by this not seeing them. And we spoke about the veil, how we said it yesterday night, the veil phenomenon. As a, I think, globally veil phenomenon, that we veil, like a wedding, but it's not. So, as Uno brought Jeanette, I'm bringing Professor Carol Gilligan, and I like this quote of her. I'm research with her protocol with combatant and about silenced voices, and also with women who've been abused. And I like this quote because it's very simple. Somehow, physician can relate to that instead of what we speaking about dissociation. Trauma is the shock to the psyche that lead to dissociation. Our ability to separate ourselves from part of ourselves, to create a split within ourselves so that we can know and not also know what we know, feel and yet not feel our feelings. It is our ability to hold parts of our experience not as sacred from others, but as a foreigner body within ourselves. And when I read this, I felt, okay, this is bring me the leg that can protect and also can open the leg. It's this can be either all the parts. And back to the A study that I went and saw the unexplained symptoms of distress, physical symptoms, and look, as much as more trauma, multiple trauma, the most unexplained symptoms, like physically symptoms, the A study found. And I'm taking you back after that to Triana, what we started yesterday, just to glimpse about Triana, that Professor Lev Wiesel, Rachel, have done 2014, 2,035 children, and they gave them iPads and asked them, currently, are you being abused? Straightforward, like direct question. The children, look what the children in Israel said. 12,000. It's almost like A studies, like very close to the A study. So, see, sexual abuse of the children, 18% currently said we are being abused or had been abused, and 17% said physical abuse. Okay, so this is not as adults, like a study. It's currently they are being abused. So every child in the education system and in healthcare, like we should look forward and see 52% of the children are said that somehow they were involved with this veil phenomenon. Veil? Yes, veil, right? So two of the children who step into the ER in Kaplan Medical Center have been exposed to somehow child abuse. So we see just the iceberg. And so we started from there, and we started to think, okay, so we know about trauma of adults, so how can we figure out about the body and how the body speaks? And we started to see that when we started to ask the Triana, Triana asked, the researchers asking Triana, what will help you to disclose your abuse? And they said, direct question. Just ask us direct question. So we started to ask children direct question. And the children who we asked, and they came to us about suicide attempts, headaches, urinary blood, abdominal pain, syncope, and shortness of breath. With the sometimes thought that it's asthma, but it wasn't. And we started, and I will start by a case study that a 15 years old girl came. She had syncope, she fainted, the ambulance brought her from school. The physician in the ER has done to her physician exams, EAG, labs were normal, so everything was literally fine. And the next step was to say to her, it's all on your head, right? Like Shai said, it's all in your head. Or psychosomatic, and go back and start therapy somehow, or consulting. But then our physician in the ER and Dr. Bala and the staff understand that if we return children back home, that we are going to return them to the battlefield. So instead of that, and usually the parents won't send them for treatment or everything until the next stress. So we started to figure out how can we find what happened there, because this child, this child, what happened to her, the physician asked her, something happened to you? Someone have done to you something? And she said to him, no. Then she went home, and he said to her father, I think she needs to stay in observation. And her father said, no, it's better that she will return home. And the physician called me and said, I lost her. And I said, you've done what you've done. You said to her 24 hours you can come over to the ER, and he said, yes. I said, you ask her. And then she returned after a month, and she said, how did you know that? And he asked her what? And she said to him that I was abused, that I was raped. And he said, I didn't, I just asked. And she said, and then I called her, and I asked her, why did you come back? Why? And she said, nobody sees me. He asked me, he saw me. And I said, how did he saw you? And she said, he asked me. He just asked me. So then she said about all her physical symptoms. And then in that time, I was in EMDR conference in Tel Aviv, and Uno spoke about, somehow about, it was in Slip of Your Tongue or something about the somatoform dissociation. I caught you in the break and said, hold on, please, can I be an Israeli, cheeky Israeli? And can you explain? And then you sent me the somatoform dissociation. And we started, because we are in the medical arena, and doctors love tests and mechanism. We should bring, right, Karen? Love. And we should have, like, find the mechanism of physiological mechanism. And in physical abuse, it's easier. Why? Because you can see forensic, you can see the mechanism of the belt, right? You can see the forensic, the slumps of the hands on the child. But sexual abuse, again, it's a veil. We can't see. It's not sheer, right? Sheer is not the right word.
Yeah, sheer means you can see through.
Okay. Transparent. Sheer I love because it's similar to my name. So we started to look together with the somatoform dissociation questionnaire. We started to see physical and physiological symptoms. We saw syncope, headaches, abdominal pain, and compresses, ADHD. So, and in the mental side, you see depression. Okay, and what can I do? Depression and anxiety. But you can see the physical, also the literature correlate in splitting mental and physical. And we said it's one. We are one human person. We are not divided from mental and physical. We are together. So we started to look about, I said evidence, right? Mechanisms. So we started to look for children and to see tools, to find tools, like forensic tools. And then I will take you 20 years ago to when I was in San Diego, and Bob said to us, look, I can diagnose, or I can, because I'm a psychologist, you are not psychologist, you're a social work, but you can take questionnaire and do with questionnaire, and then it will be, you can use them. And I went with this idea and said, let's take the somatoform dissociation with these children and look what happens there. So we started to use clinically with the somatoform dissociation and PDEQ and DES. This is all dissociation questionnaire, and it didn't work. It didn't work. And we didn't find why it's not working. So we went back to the literature, how you create the somatoform dissociation, and I'm so happy that you are here, because I went back to and saw that what the paper said, that you took women with DID, with disorder, but we are looking for children, and that didn't start the dissociation disorder with symptom. Because of that, we figure out that the somatoform is not working clinically on these children because they are not yet in dissociation with dissociation disorder. We can find them before that. We started to we set for expertise, for mental health, Professor Lev Wiesel, child abuse and neglect, Dr. Bala, and myself. And we took the clinical, what we have done for the last 7 years with clinical observations about physical, the somatic, the somatoform dissociation, and what we have known. And we create 30 items that were scales for psychological, dissociative, and physiological. The 30 question, there is no question about sexual abuse. This is just the way that we will detect red flags. So 541 adults. Look how many ADHD were 20%. This is mean that maybe it's misdiagnosed ADHD, and a lot of the ADHD diagnosed children are abused. And this is like, because if I will say to you now, listen to me, listen to me, listen to me, listen to me, why you not listen? You won't, because someone is hitting your head, okay? So this is where the instruments, lots of instruments from dissociation and trauma, and you can see that it's very, you can see that that physiological, dissociate and psychological scales. And now we are into analyzing more deeply and drill down to the more of that, and we found that as much as the volume of the MSDQ is higher, it's more, we can indicate a more of abuse. It's and what is the chart now? It's the child is coming with physical symptom. If the physician didn't find some physical evidence. So if they find medical diagnosis, so they're giving him medical treatment. If it's not, the physician don't find the medical diagnosis. So either they're starting to do MSDQ and self-figure drawing that I won't speak about it today, and if it's about the trauma, it's from a divorce that usually parents will say about it, a divorce, death in the family. This is things, that trauma that family won't hide. So they will ask them if something happened in the past. They and then if not, they will give them the questionnaire, and then we will start to figure out and this is the process of child abuse process. So we can see that MSDQ is an indirect evaluation tool for sexual abuse, focused on otherwise of undiagnosed children, and may aid healthcare professional evaluating patients with suspect abuse. We're doing now research for 1,000 children. We're giving them iPad, like the Triana research, and they finish in 10 minutes the questionnaire. It's amazing to see how the children like doing like, it's just amazing. We give another layer in the creation of multidimensional evaluation, and the combination of MSDQ and indicators of self-figure drawing increase the prediction to accuracy. And Rachel, do you want to put the link? Anima. And I will show you briefly the questionnaire, because it's so easy. Very physical, so then the child cannot suspect, and I'm not doing it. The physician or the nurse are doing them, so it's not like, the social worker is coming, so maybe they will take me out of home or something like that. So if you want, you can just join. We joined to Triana project, the Anima project. And Rachel, will you speak about Anima, Rachel? No. So this is what we show there in Honolulu. Okay, somatic concept. Can you read it? Thank you.
Stomach aches, constipation, chest pain, or feeling suffocation of breathing, heart palpitations, sleep difficulties, nightmares, etc., difficulty concentrating, exhaustion or tiredness, tantrums, rage, irritability, feeling that you cannot move, tickling in legs and hands, physical instability, shaking or trembling, mouth dryness, can't feel your body, feeling that your eyes are covered by fog or your sight becomes blurred, plan to go somewhere but find yourself in another place, feeling as if parts of your body disappeared, feeling that your body does not belong to you, leaving the class without remembering what was learned, changes in the sense of time. You go to get one object but come back with something else. You have an imaginary friend or friends. Your moods shift often. You prefer to be alone. You are attracted to sad things such as movies or books. Is there more? Ah. And then the rest.
So this is like more than psychology.